Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. This video is for informational and educational purposes only. It is not intended as medical advice and should not replace consultation with a qualified healthcare professional. Always seek the guidance of your doctor or other licensed medical provider regarding any questions you may have about your health or medical condition. In this video, I'm going to go over what a SOAP note is, how to write one, and go over some tips. A SOAP note is a structured method of documentation used by dental professionals to capture clinical details of patient encounters. SOAP stands for Subjective, Objective, Assessment, and Plan. These notes provide a clear and concise overview of the patient's medical condition, diagnoses, treatments, and progress over time. A SOAP note can be used by hygienists, dentists, and other healthcare providers to share patient information to improve the quality of patient care. Detailed SOAP notes are necessary for meeting regulatory and legal standards, and they serve as proof of all care provided to patients in cases of audits and legal actions. First, we have S, Subjective. This section captures the patient's reported experiences, symptoms, and concerns. This includes information given by the patient related to their past medical surgical history and their family history. There are several parts that go to this section to make sure the information documented is full and complete. The first component is the chief complaint, or CC. This is the primary reason the patient is seeking dental care. It should be stated verbatim in the patient's own words. An example of this would be, "I have pain and pressure in my upper teeth and cheeks." Next is the history of present complaint or illness, or HPI. This is a detailed account of the patient's current condition. An acronym to remember for organizing information is OLD CARTS. Onset. When did the CC start? Location. Where is the CC located? Duration. How long has the CC lasted? Characteristics. What is the nature of the CC? Aggravating and alleviating factors. What makes the CC worse or better? Radiation. Does the CC spread to other areas? Timing. Is the CC worse or better at certain times of the day? Severity. On a scale of 1 to 10, how severe is the CC? An example of this component would be, a 45-year-old female presents with facial pain and pressure that began 3 days ago, primarily in the maxillary region. Describes pain as throbbing and pressure-like, worsening with chewing, bending over, or head movement, and improving when lying down. Pain is typically worse in the morning. Rates current pain 5 out of 10. Next on the list is past medical history, or PMH. This is any pertinent, current, or past medical conditions, surgeries, hospitalizations, ongoing treatments, social history, and pertinent family history. An example of a recorded PMH is, patient reports a history of sinus infections 1 to 2 times per year, often causing upper jaw discomfort. Denies recent dental infection or tooth sensitivity. Currently takes fexofenadine hydrochloride 180 milligrams by mouth daily for seasonal allergies. No known drug allergies. Lastly, we will record our review of symptoms, or ROS. This is a systematic review based on a list of questions that can help to uncover other potential symptoms that the patient may be experiencing. An example of this would be, general, reports mild fatigue, no fever or chills. Facial pressure in cheek and forehead areas, reports mild discomfort in upper posterior teeth. Denies swelling, bleeding, or tooth mobility. Notes nasal congestion and postnasal drip. Denies ear pain or sore throat. Denies dizziness, visual changes, nausea, or vomiting. Our next step is O, Objective. This section of the note is for documenting observable, factual, and measurable data. This information can be gathered by physical examination, test results, and observing the patient's general appearance, mood, mental status, and behavior. This can be done through vital signs, a physical examination, and labs and other diagnostics. An example of what should be recorded is, patient appears well-nourished and in no acute distress, alert and oriented ×4, extraoral exam, mild tenderness to palpation over bilateral maxillary sinuses, facial grimacing with head movement, intraoral exam, oral hygiene fair, mild gingival inflammation, no swelling or abscess noted, slight percussion sensitivity on teeth number 3 and number 14, occlusion with normal limits, radiographs. Images reveal no periapical radiolucency, mild mucosal thickening in maxillary sinus. A is next, and it stands for assessment. This section provides a summary of the patient's clinical condition based on the subjective and objective findings. This is where you will interpret the findings and make a primary diagnosis and list any other differential diagnoses. For the diagnosis, you should provide the primary diagnosis or the most likely condition that is affecting the patient based on the information available. An example of this would be findings consistent with maxillary sinus inflammation. Differential diagnosis includes sinus-related referred pain, reversible pulpitis, number 3 and number 14, myofascial pain of mascatory muscles. Our final letter P stands for plan. This last section outlines the steps in management, treatment, further testing, patient education, and referrals to address the diagnosis that was formed from the assessment. The first component of this section is treatment. This is where you will specify any medication, procedures, or interventions that were prescribed. An example being ibuprofen 400 milligrams every 6 hours as needed for pain and fever relief per dental standing. Hydration, rest and use warm compresses. No dental procedure indicated today pending resolution of sinus-related symptoms. Next is follow-up, referrals, and consults. Here, you should indicate when the patient needs to return for follow-up or if any additional monitoring is needed. This could look like patient to be referred to primary care provider or ENT for further evaluation of suspected sinus involvement. Dental re-evaluation scheduled in 3 to 5 days or sooner if swelling, fever, or localized tooth pain develops. The last component is patient education. For this last piece, you should provide the patient with instructions on how to manage current symptoms, discuss lifestyle modifications, or any other precautions that should be taken. An example of this section would be discussed importance of rest, hydration, and warm compresses. Advise sleeping with head elevated and avoiding dairy until congestion resolves. Instructed patient to return if pain worsens or tooth sensitivity develops. Patient verbalized understanding and agreement with this plan. Now that you know what a SOAP note is and what goes into it, let's discuss some tips. First of all, it is important to be clear, concise, and thorough. This will ensure that anyone reading the note in the future can pick up where you left off with a clear view of what happened and your thought process. Next, always be sure to follow the format closely. This will make it harder for you to miss any key information that should have been shared. Lastly, if there are multiple issues, you should address the most urgent concerns first. Thanks for watching this guide on how to write a dental SOAP note. Remember, effective documentation isn't just about checking boxes. It's a vital part of providing safe, high-quality patient care. Using the SOAP format helps you stay organized, communicate clearly with your team, and meet professional standards. The Office of Correctional Medicine at Southern Illinois University School of Medicine invites you to look for more educational content in our Health Matters series.